Hays County reports first human West Nile case of 2025 mosquito season. Imagine kicking off the new year only to face the first confirmed human case of West Nile virus in Hays County for 2025. This underscores how seasonal health threats can re-emerge and impact communities unexpectedly. But here's where it gets controversial. While most people shrug off this illness, a significant minority may find themselves battling symptoms that range from mild discomfort to more serious health issues. Hays County's health officials announced on Tuesday that a confirmed positive case of West Nile virus has been identified within their jurisdiction, marking the beginning of this year's mosquito season with an unsettling highlight. This is notable because, although 80% of those infected show no symptoms at all, the remaining 20% may experience a variety of symptoms, such as fever, persistent headaches, body aches, joint pains, vomiting, diarrhea, a rash on the torso, and swollen lymph nodes. What makes this situation particularly noteworthy is the transmission mechanism of West Nile virus. It's primarily spread through bites from infected mosquitoes, which acquire the virus by feeding on infected birds. This cycle underscores how interconnected our environment and health truly are. As of now, Hays County reports that the Texas Department of State Health Services, DSHS, has not yet confirmed the presence of any positive mosquito pools locally for 2025. However, statewide data reveals that 272 mosquito pools across Texas have tested positive for West Nile virus this season, showing how widespread the issue can be. This development raises important questions. Are current mosquito control efforts sufficient to prevent a wider outbreak? How vigilant should residents be in protecting themselves? And does a positive human case signal a looming rise in mosquito-borne illnesses this season? Diving deeper into the complexities of mosquito-transmitted diseases reveals the importance of community awareness and proactive health measures. Public health officials often grapple with balancing measures like insecticide spraying, habitat reduction, and public education, all crucial in preventing outbreaks. So what do you think? Are we doing enough to combat the threat of West Nile virus? Or is this a sign of more to come this mosquito season? Feel free to share your thoughts or experiences below. Your insights can help others better understand the risks and protective strategies involved. First human case of West Nile virus in Hays County. What you need to know. A shocking new chapter in local health concerns has just begun. Hays County has officially reported its first human case of West Nile virus for the 2025 mosquito season. While officials are keeping the patient's identity and location under wraps, this news sends a clear message. This isn't a hypothetical threat anymore. But here's where it gets controversial. Many residents might shrug this off, thinking, "I've lived here for years without issues." Yet the reality is far more complex, and this is the part most people miss. Even asymptomatic carriers can unknowingly contribute to the virus's spread. Let's break it down. The Hays County Health Department, HCHD, confirmed the case on Wednesday, July 30th, but emphasized that privacy laws prevent them from sharing details like zip codes or personal identifiers. As one official explained in an email to MySA, "We can't risk exposing sensitive information, but we can and must educate the public. And that education starts with understanding the virus itself." Here's the cold truth. About 80% of infected people show no symptoms at all. That means you could be bitten by a carrier mosquito and never know it. But for the remaining 20%, the consequences can be severe. Symptoms like fever, body aches, rashes, and swollen lymph nodes are common, but the real danger lies in the 1 in 150 cases that escalate to life-threatening conditions, as confirmed by the CDC. Older adults and those with weakened immune systems, they're in the crosshairs. Imagine a grandparent tending their garden or a cancer survivor enjoying the summer sun. Suddenly, a harmless-looking mosquito bite isn't so harmless. Texas has a history of West Nile activity. Last year, over 3,300 infected mosquito pools were identified statewide, with Hayes County among them. In 2025, the state has seen 272 positive pools, but none in Hayes County until now. This shift raises questions. Is this the start of a surge or an anomaly? Some experts argue that climate patterns and urban development might be playing a role. Want to weigh in? Share your thoughts below. So, what can you do to protect yourself and your community? The HCHD's 3D strategy is your playbook. 1. DEET. Use EPA-approved insect repellents. Think of it as a mosquito force field. Just apply it to exposed skin. 2. Dress. Opts the long sleeves, light-colored clothing, and tight weave fabrics. Mosquitoes are less attracted to lighter hues and can't bite through thicker materials. 3. Drain. Eliminate standing water in gutters, flower pots, or bird baths. These are mosquito nurseries, and you're the cleanup crew. Development Services and the HCHD aren't sitting idle. They're ramping up surveillance, including mosquito trap monitoring. Curious about what's happening in your neighborhood? Check the interactive map here, https://Hayes County mosquito tracking locations, for real-time updates. And now a final thought to chew on. If 80% of cases are asymptomatic, does that mean West Nile isn't as dangerous as we're being told? Or does it highlight the importance of community-wide prevention? We'd love to hear your take in the comments. Are you taking extra precautions this summer? Or do you think the risk is exaggerated? Let's start a conversation. Reporting by Nicholas Hernandez, a digital reporter for MySA. A Seton Hall University alum with a master's from Craig Newmark Graduate School of Journalism, Nicholas has contributed to ETA, AMNY, and NJ Spotlight News. He's also a proud member of the National Association of Hispanic Journalists. July 30th, 2025. First human case of West Nile virus confirmed in Hayes County. West Nile virus has finally made its way to Hayes County, and this first confirmed human case signals a warning everyone should pay attention to. On Tuesday, the Hayes County Health Department, HCHD, officially confirmed that one person has tested positive for West Nile virus, WNV. But here's where it gets tricky. The county is keeping all details about the patient strictly confidential to protect their privacy, so no further personal information will be disclosed. So what exactly is West Nile virus? It's an illness transmitted through the bite of a mosquito that has become infected by feeding on the... However, the remaining 20% might experience some fairly uncomfortable signs, such as fever, headaches, muscle aches, joint pain, vomiting, diarrhea, skin rash on the torso, and swollen lymph nodes. If you or someone you know starts showing these symptoms, the county encourages seeking medical care promptly. While the majority of people face only mild symptoms, it's crucial to understand that certain groups are at greater risk for severe complications. Folks who are 50 years old and above, as well as individuals with weakened immune systems, may suffer intense issues like stiffness, confusion, coma, tremors, loss of vision, paralysis, and in extremely rare instances, even death. But here's the controversial part. There is no specific cure for West Nile virus. Treatment focuses on symptom relief, often using over-the-counter medications to reduce discomfort. Patients typically experience symptoms lasting between 3 to 6 days, but fatigue and weakness can persist for weeks or sometimes months after. The county also highlights the risk of neurological complications from severe WNV cases, including encephalitis, inflammation of the brain, and meningitis, inflammation of the membranes around the brain and spinal cord, both potentially serious conditions. Given this information, it's clear that preventing mosquito bites remains the most effective way to avoid WNV. Hayes County provides resources on mosquito control and prevention measures on their official website for those who want to learn more. Now here's a question worth pondering. With mosquito-borne illnesses like West Nile virus spreading into new areas, should there be more aggressive public mosquito control programs? Or should efforts focus more on individual protection and education? We'd love to hear your thoughts. Do you think enough is being done to protect communities? Or is this a warning sign that we need to step up our game? Share your opinions in the comments below.